The topic that we are going to discuss now is nicotine addiction treatment. What is nicotine addiction treatment and what is the new thing that has been emerged or studied or researched under this treatment? Let us understand that. So, in a recent study set to redefine nicotine addiction treatment, researchers have unveiled a breakthrough method leveraging vitamin C and nicotine. What is this nicotine? Nicotine is a nicotine metabolite. What is a metabolite? Metabolite is nothing but an end product of metabolism. Okay, after we in our human body metabolize the nicotine, the end product is called as metabolite, and nicotine metabolite is nicotine here. Okay, so they are going to leverage these two chemicals, that is vitamin C and nicotine. How are they going to do it? Let us understand that in the upcoming slides. And this approach goes beyond the conventional nicotine replacement therapy. At present we have nicotine replacement therapy. Let us understand about that also. But then this new research goes beyond the conventional therapy that we already have. So what nicotine is? Nicotine is a plant alkaloid. Okay, so it is a plant alkaloid that contains nitrogen, which is found in several types of plants, including tobacco plant. Okay, the main source here is tobacco plant, and this is very important that it can also be produced synthetically. Such statements are important from exam point of view. Nicotine can be produced synthetically also. Okay, and then it is both used as, it is used as sedative as well as a stimulant. Okay, so nicotine acts as a sedative and also acts as a stimulant. Okay, and then it is the main psychoactive ingredient in tobacco products. Very important. And this, that is the metabolite nicotine, is formed as a major metabolite of nicotine after tobacco smoking. After tobacco is being, after we consume tobacco or after we metabolize tobacco, the end product here is the nicotine. Okay, so let us understand how this new treatment works, and before that we must have to know what nicotine replacement therapy is. Okay, so nicotine replacement therapy, it is a treatment to help people to stop smoking. That is why we are having this nicotine replacement therapy, and it uses products which supply low doses of nicotine. Okay, so we have to come out of the addiction of nicotine, but then it is being done by giving small doses of nicotine. Okay, so these products do not contain other toxins which are found in smoke. So that is how we are avoiding smoke. Okay, so we are avoiding smoke by avoiding the toxins that are contained in the smoke. Okay, rather we are also including nicotine in smaller doses into our body. That is important here. So the goal of this therapy is to cut down on cravings for nicotine and ease the symptoms of the nicotine withdrawal. Okay, there are certain symptoms of nicotine withdrawal which we'll understand, and to ease the symptoms we are doing this, and we are also doing this therapy to cut down on the cravings for nicotine. So this nicotine replacement therapy products come in several forms like gum, transdermal patches which can be stuck to any part of the body, and nasal spray, oral inhalers and tablets. These are the things which are there under nicotine replacement therapy. And what is the current nicotine replacement therapy that we have? So currently the therapy relies on providing additional nicotine to the body through patches and lozenges, that is tablets. Okay, so these are all the different replacement therapies that we have now: nasal spray, skin patch, inhaler, gum, and then sustained release tablets. Okay, so these are all the things that we have. Moreover, counseling is also yet another option to come out of nicotine addiction. Okay, so individuals find it challenging to quit smoking. That is because of the symptoms of nicotine withdrawal. Okay, so nicotine withdrawal manifests like cravings, irritability, anxiety, increased appetite, and difficulty concentrating. So these are all the problems that they face when nicotine is withdrawn from their daily use. That is why this nicotine small doses are given to them. Okay, so this is how present nicotine replacement therapy works. But what is the new innovation that has been made, or the new research that has been made? So researchers explore cotinine. We already discussed that it is a metabolite of nicotine. So cotinine, which is nicotine's oxidative metabolite, as an alternative approach. How are they going to do this? In humans, generally 80% of the nicotine accumulates as cotinine in the body, while the remaining 20% is eliminated in urine. And then this cotinine can cause cancer. Nicotine accumulation can cause cancer. Okay, so researchers used ascorbic acid. What is ascorbic acid? Vitamin C is also called as ascorbic acid. Okay, they are going to use this vitamin C as a reducing agent to convert cotinine back to nicotine. Okay, so they are going to reduce cotinine to nicotine. I hope you understand this, that nicotine is getting oxidized to become cotinine. Now, using this ascorbic acid, that is vitamin C, which is a reducing agent, the opposite is going to happen. That is, they are going to convert cotinine back to nicotine, which is recirculated in the blood to prevent the nicotine urge. When nicotine is recirculated in the blood, then the craving for nicotine reduces. That is how they are going to work. Already stored cotinine is going to be converted to nicotine, so that fresh doses of nicotine need not be given. Okay, and researchers made a dissolvable film of vitamin C for smokers to use when tempted to smoke. So a dissolvable film of vitamin C is given now. Earlier, vitamin C was not given. A small dose of nicotine was given, but now a small dose of dissolvable film of vitamin C is given here. Okay, and ascorbic acid, that is vitamin C, in specified dose facilitates conversion of cotinine to nicotine within the smoker's plasma. What is plasma here? The liquid portion of the blood. Okay, and then vitamin C helps to turn cotinine into nicotine without any side effects. Okay, in earlier nicotine replacement therapy, they introduced nicotine in smaller doses, which will again be having side effects, which will get accumulated in the body, and it will cause cancer like diseases in future. But then this vitamin C therapy is without any side effects, and then the body gets rid of all the toxins at the end without needing extra nicotine. This is very important. There will not be any need for extra nicotine when we go for vitamin C process. Okay, now we have to understand what is the status of tobacco consumption in India. Nearly 276 million adults, that is people who are 15 years and above in India, are users of tobacco. Okay, that constitutes to 29% of all the adults in India. And then the most prevalent form of tobacco use in India is smokeless tobacco, which is very important. Okay, statements like these are also important, which can be asked in your exam. The most prevalent form of tobacco in India is smokeless tobacco. Okay, but then smoking forms are also there, like BD, cigarette and hookah. But then this smokeless tobacco forms like gutka, zarda and betel leaves, which are having tobacco products, these are the things which are most prevalent form of tobacco use in India. Okay, next, tobacco use is the major risk factor for many chronic diseases, including cancer, lung disease, cardiovascular disease and stroke. And then it is one of the major causes of death and disease in India, and it accounts for nearly 1.35 million deaths every year, which is a huge number. Okay, and then India is also the second largest consumer and producer of tobacco. Okay, so these are the things which we need to understand, and what are all the government initiatives which are related to tobacco consumption in India. First one is Cigarettes and Other Tobacco Products Act, which was enacted in the year 2003. So the act applies to all tobacco containing products which are outlined in the act's schedule. Okay, and then this act prohibits advertising and regulates trade, commerce and production, supply and distribution of cigarettes and other tobacco products in India. Okay, next we have a national tobacco quit line service. Okay, so the objective of this quit line service is to provide telephone based information, advice and support and referrals for tobacco cessation, for tobacco quitting. Okay, so this is a telephone based information system. Next is National Tobacco Control Program. This was launched in the year 2007-8 during the 11th 5-year plan period. Why was this launched? It was launched to create awareness about the harmful effects of tobacco consumption and to reduce the production and supply of tobacco products. Moreover, it was also launched to ensure effective implementation of provisions under that COTPA Act, which we saw in the previous slide, and then also to help people quit tobacco use and facilitate implementation of strategies for prevention and control of tobacco, which was advocated by this framework convention, that is WHO's framework convention of tobacco control. Okay, so this is what we need to understand from this topic, that ascorbic acid, that is vitamin C, can be used for converting cotinine, that is a metabolite of nicotine, which can be converted back to nicotine again. Okay, thus nicotine urge will be reduced. Okay, I hope you understood the concept.